Hi, welcome to my channel. I'm Dr. Zawish. Tonight I'm going to be talking about one of common questions that I've been asked at my practice by my patients, and that is, should I use ice or heat when I'm injured, or when I should use the ice, and when I should use the heat? It's a very important question because if you're using the wrong thing, it can actually increase more pain depending on the injury that you have. So to start with, let's talk about what does each ice and heat do. Number one, ice. The main purpose of icing is to reduce inflammation, reduce pain, and reduce the blood flow to the area. And we use heat to do the opposite, increasing the blood flow to the area, softening up the muscles, increase the flexibility of the muscles, and to kind of soothe the pain, especially the chronic pain. So the question, should I use ice or heat? The rule of thumb is that if you don't know which one to use, always use ice, because ice will not do any harm if it doesn't do any good. But heat, if it's not supposed to be heated and you use heat, that will increase the pain and symptoms and things like that. So whenever you're not sure, always use ice. Now, we use ice for acute injuries. Now, what's acute injuries? Acute injuries like falling, straining, spraining your ankles, sport injuries. You play sport, you get tackled, you have your neck gets whiplash and things like that. The events that happens very quickly. So for those things, you have to use ice, and for the first day or two you just have to keep icing them, and the method of icing them is about 5 to 7 minutes on, 20 minutes off, and 5 to 7 minutes on and 20 minutes off, and repeat this process for about maybe 4 or 5 times each day. And what it does, again, like I mentioned earlier, it reduces the pain, reduces the inflammation, and constrict the blood flow. Therefore, the inflammation will go down, and the pain will be easier. And the subacute pain, it's the next stage, which is the injuries that it's been there for about maybe 3 to 4 weeks onwards to maybe few months. We call those subacute pains. And chronic pain, anything that's been more than 3 4 months onwards, that's a chronic pain. So for ice, you use the ice for acute for sure, and sometimes for subacute injuries. And then the heat, it usually comes into play for the late stage of subacute injuries and chronic injuries, like the injuries that's been there for quite some time. You have soreness of the neck that's been there for a month or maybe a year, and it comes back time to time. You have to heat these type of injuries or tissues or body parts to loosen up the muscles a little bit, to relax the muscle tension and things like that. So again, the best takeaway message from this video is that if you're not sure whether you should ice or heat, always go with ice, because icing is much safer, and then until you find out what you need to do for sure. So having one of these things in your fridge or freezer will actually come handy. Sometimes it's good to have two of these, so as you apply them, with these ones, you don't really have to time it, because usually after 7 8 minutes they become a little bit more warmer, so you can use the other one and continue icing it, and keep switching them back and forth. And for heating pad, you can use electrical heating pad. You can use those bean bags that you put them in the microwave, or you can use moist heat like showers, bath. The thing that you should know about moist heat is that it's much better than a dry heat because it penetrates deeper. Moist heat is steam room, hot tubs, bath, warm or hot showers. And when you heat your body part, your neck, shoulder, back, uh, heating time should be about somewhere between 10 to 15 minutes max, and then you give it a break for about maybe 10 minutes, and then you heat it again, and that actually loosens up the muscles a little bit. I'm just gonna go back to the subacute injury that I talked earlier, when I said at that stage you have to ice and heat together. The reason for that is you create that pumping mechanism which increases the blood flow. Blood brings nutrients and oxygen to the area, so it helps repair the tissue. And then when you ice it, you basically remove the inflammation away. And that's usually for subacute injuries. And how you do it is that you ice it for about 5-7 minutes. You wait for 20 minutes. You warm it up for 10 minutes. You wait for 20 minutes, and then you do the ice, and then you repeat the heat, but you always finish with ice. Let me see if there is any other topic or the issue regarding icing and heating. No, it's probably I covered most of it. So yeah, if you're not sure whether you should ice or heat, always ice until you find out from your healthcare professional, whether your family doctor, chiropractor, physiotherapist, massage therapist. But it's always good to have one of these and just ice them. But the best is to prevent injury from the first place. But if it happens, just ice it right away. I hope I answered your question with this, or kind of clarified the topic a little bit. Again, if you have more questions or you want to get into a specific part of this discussion a little bit more further, please drop a comment down below. And if you like to receive more videos, educational videos about these kind of topics, you can always subscribe and you get those videos right away as soon as it comes out. I hope you have a great night. Be safe and don't forget to ice when you need it. Take care. Have a good night.